So why do I love my job so much? And honestly, that is a great question. In today's video, I'll be going over 5 reasons why I love my job as a Psych NP. What's going on, everyone? It's a Psych Dude back again with another video. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude and I'm a board certified Psych NP. In this channel, I go over several different subjects to educate the public about improving mental health, topics related to psychiatric nurse practitioners, and ways to improve your overall lifestyle. I hope you guys enjoy this video and don't forget to like and subscribe for future videos. So a common question I get often is, do you really enjoy working as a Psych NP with psych patients? The first question I typically ask them right after they ask me that question is, do you enjoy solving mysteries? The reason why I ask that question is because working as a Psych NP is like solving a good mystery. You get to hear about patients' life stories. You get to interpret their story and look for symptoms or clues. You get to assess for certain factors that might affect their daily lives. And once you do that, you get to piece together information. Once you gather enough information, then you get to come up with a solution. Sometimes that solution isn't the right one at first, but you get to go back to the drawing board to see what you missed or what you forgot. Then try again until you solve the case or get them stable on a certain medication or certain regimen of medications. Or maybe even therapy, and it's your job as a Psych NP to actually do that. So building on that, here are 5 reasons why I love my job as a Psych NP. Psych NP. So reason number 1, you get to problem solve on a daily basis. If you love solving problems and love finding solutions to these problems, then this career is a good one for you. I love to solve patients' problems by using every bit of information provided. I love using this information and assessing what is the next best option and what is my next best step for them. Is it therapy? Is it medications? Or is it both? If it is medications, what type of medication am I going to choose for them? Will this medication affect their overall mood, and at what cost? So I ask myself, will this medication make their medical condition worse? Will this medication cost too much for this patient? Will this medication side effects cause them to slack off at work until they reach that therapeutic level? Will that time off from work affect their family's lives? Honestly, there's so many different factors, and it's up to me to decide what is best for them. I have to outweigh the risk and benefits. I get to solve that problem and ultimately come up with the best solution for them. So reason number 2 on why I love my job, the decisions I make are life-altering. The second reason I love my job as a Psych NP is because I get to make life-altering decisions. Ultimately, it's my decision based on evidence-based practice and education to come up with what medications will work best for the patient or not. Obviously, I'm not 100% perfect. I don't think anyone is in finding which medication or solution is the best one for the patient. But when I do choose the medication, and especially when I do choose the right regimen of medications, I can change their lives for the better. And knowing that I change their lives for the better makes my job completely worth it. So imagine helping someone with psychotic symptoms who unfortunately had their kids and families taken away from them from DCFS. But now imagine a couple months later, that same person coming to thank you for helping them with therapy and medication management to help them get off of drugs and have their families back together just in time for the holidays. Imagine how great of a feeling that is. And honestly, that feeling is so special. And that's another reason why I love my job as a Psych NP. So reason number 3, I get to talk to people all day long. So as a kid, I never shut up 1 minute. My parents would always tell me stories of me constantly talking and talking and talking without stopping. They would tell me stories about going on long distance road trips from like 6+ hours long with me talking the whole entire trip. I've been a naturally talkative person, and now I chose the perfect career. I get to talk to people all day long. I do a lot of listening, of course, but for the most part, I love how I'm able to develop relationships with other people. And that's important to me, is because I'll be able to talk to them, listen to them, and be able to give my advice in terms of what's going on. I'm lucky enough to develop these relationships through the art form of conversation. So reason number 4, I can work in so many different settings. Honestly, this is another reason why I love my job, is because I can work at so many different places. It's unbelievable on how many opportunities are out there. Right now, I work in 3 different settings. Yes, you heard that correctly, 3. I work at a community mental health facility with severely mentally ill. I work at a private practice outpatient clinic, and until recently, I got a job doing telepsychiatry. Yes, you heard that correctly, telepsychiatry. Yes, I get to work from home, and it's so amazing. I'm able to see patients, and also in between patients, I'm able to spend time with my son. It's a dream situation. Think about it. Seeing patients through the computer and spending time with my son, perfect situation. Honestly, if you don't really like doing outpatient and it's not your thing, you can work in so many different settings like I mentioned in a previous video about where Psych NPs can work. Go watch the video on what is a Psych NP. I'll put that link in the description box below, but definitely check that video out because it does give you more information on what settings you can actually work in. Last but not least, reason number 5, my body doesn't hate me on a nightly basis. So you must be thinking, what do you mean by that? Well, if you're RN or if you're familiar with bedside nursing, a lot of work starts to take a toll on your body. It's very labor intensive. All that wear and tear starts to kick your butt, literally. All that bending, repositioning, changing, and making beds will do a toll on your body. And eventually you'll be sore or in pain on a daily basis. I've seen so many nurses develop carpal tunnel or chronic back pain or chronic knee pain because of bedside nursing. But now picture my job as a Psych NP in the office. I get to sit down and not have to worry about doing anything manually intensive. The most manually intensive thing I do on a daily basis is take a blood pressure. This is my favorite reason on why I love to be a nurse practitioner. It's because I don't have to do so many things that hurt my body or that will eventually lead to having chronic pain on a daily basis. I hope these 5 reasons intrigued you in wanting to become a Psych NP or to work in psychiatry or mental health. This was just a sample of the things I love about my job, but these are the top 5 things worth sharing. If you like this video or you like this type of video and want me to make more of these type of videos, please comment down below or give me suggestions on other videos you would love seeing. Thank you for joining me, guys, the Psych Dude. Don't forget to like and subscribe and click on the bell button to be notified when I come out with another video. Until next time, take care of yourselves. The Psych Dude is out.